student physical therapist. Today we're going to try to get that knee moving a little bit and actually get a little bit of resistance going. And so since we're in that subacute phase, we're really not going to be pushing anything too hard, but we do want to start getting that muscle activation. So the first exercise we're doing is going to be a seated single leg press. And this is just going to be vital to getting that pushing power to get up into that left stirrup. And then because we're not quite at that full push it as much as we can stage, we are going to do a lower weight, which is why we're also using the machine. Because what's your body weight right now?
160.
160. So just because a body weight squat was still a little bit painful or maybe a little bit limited, we're going to start lower than 160 on the machine. And so for this, we're going to set it up. For you, it's going to be a little bit farther away just since you're taller than me.
Yep.
But ideally, to where we're getting a good bend in that knee. And we're going to be working in the mid-range initially, so we're not going to be bringing it into full hip flexion or knee flexion or full extension. So I'm going to bring the weight to a lower level. You're going to want to keep the foot kind of centered on the pad just so we're not pushing our body at a weird angle.
Okay.
And then you'll push. Go to about 90% of extension, so there's a bit of a knee bend in the knee,
Yep.
and we'll bring it back down.
Okay.
And that could still be a little heavy, so we'll actually bring it down initially. And then, you're looking good today. I know that your friend told you to wear hot clothes when you work out. We don't want to do that too much. We want to be able to sweat and get some good heat efficiency.
Yep.
And then we're going to want to make sure to breathe through this exercise. So try not to hold your breath. And because this is lighter, we can take it slower. It should be easier to manage.
Okay.
And then because we're seated, you shouldn't have to worry about balance or confidence as much. This should really help you be able to feel how much weight you can put into that leg and start building us up from there.
Okay, sounds good.
And so I'll have you sit in the chair. Perfect. And then we'll keep the one leg down now. We'll center this leg a little more on the machine. And then does that feel like too much bend or feeling all right there?
That's all right.
And then you're just going to push off of that leg. Right about there. So we still want that bit of a bend in the knee, and we should get some quad activation.
Okay.
We'll bring it down. And so for this, we're going to do 3 sets of 12. So we'll do 12 of these in a row.
Okay.
And then you're going to rest 3 minutes in between, and that's just going to make sure we get all the oxygen back to the muscle in between, and we're not going to push it too far. And then while we're doing this, we're going to watch for any signs of inflammation or any increased discomfort or pain during the motion. And then for at home, ideally, if you have a rec center or a YMCA like this, I would find a machine similar. They're pretty common.
Okay.
If you don't, I think at home what can be utilized is still using the seated position at first just to take the core out of it, but you can almost use a band to push against or some kind of resistance in front of you.
Okay.
And if we do end up picking a band, I'll lay out how much elongation and stretch we want to get on that too.
Okay, that sounds good.